Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 282. Today we're in for a real treat. We have with us Lyn Delmastro-Thomson. Her website is BodyTalkPortland.com. I love her message. She's going to teach us an exercise today that I want everyone to know. This is the ability to actually listen to the symptoms of our body is the most important thing we could possibly do. You know, we could catch diabetes early on. We could catch cancer early on. We could catch major things and listen and then take the actionable steps, the little correctable steps needed. Whether it's, I'll give you a quick example. My friend was eating tofu the last few days and developed a sinus issue and then got dizzy. And if it wasn't for the fact that she's like staying over at my house, I started quizzing her, like, what did you change in your diet? What are you eating differently? What are you doing differently? And we figured out, we nailed down it that she's allergic to tofu. And she would have just kept eating it and kept feeling dizzy and kept getting like weirder and weirder symptoms. And so it's listening to the body early on instead of waiting for something to break. And so Lyn's going to teach us all about listening to the body. I'm so excited to have you here today.
I'm so excited to be here.
Absolutely. I definitely want to dive into your story and your background and also talk about how you came up with the techniques you've come up with to teach us how to listen to our body, which I think should be taught in school. You know, we teach math, science, history. We should take kids aside and teach them how to listen to their body and be in tune with not only their emotional body. So we have emotional intelligence and then develop some emotional quotient so that we have more delayed gratification instead of, you know, getting the instant gratification of the cookie right now. Becoming more responsible with our emotional body, but then also our physical body, listening to those symptoms early on. Of course, everyone knows I have a headache, I take some Advil versus, oh, I have a headache. Maybe I'm dehydrated. Maybe I need to get up and stretch from the computer. Maybe my eyes are strained. You know, taking that headache to mean something other than I need to self-medicate, right? And so I know that's everyone knows that one, but you're going to teach us some interesting ones today. I'm really excited. Let's start off by learning a bit more about Lyn. Tell us about your background and what led you towards this, both personally and professionally, led you towards wanting to teach us these wonderful methods.
So the work that I really do in the world has to do with my own life experience, as I think it has to do for a lot of people who get into the healing field. Mm-hmm. Straight out of college, I went to graduate school and I thought I wanted to be in the world of academia and I wanted to be a professor of history. And looking back at it, I realized I was just scared. I was not ready to be a grown-up and get a job. And for some reason, the idea of going to graduate school and spending however many years it was going to take me to get a PhD sounded a lot less scary than getting a job. And as soon as I got into my program, it just felt like a complete and total mismatch for me. I just didn't feel like I belonged there. I didn't feel like I was excited as my, cohort in the program. Everybody was like talking about these books with all this excitement. And I was like, really? We're going to sit and argue about what somebody else wrote about a historical event? It didn't interest me. And I kept pushing that down for about 3 years. And at that 3-year mark, I was supposed to have elective surgery during the summer. And that night before the surgery, the surgeon gave me a phone call and he said that my pre-op blood work had come back and showed just all of these abnormalities. And he said, let's first just make sure it wasn't a lab error. And I want you to go back and they'll run it again tonight and just make sure that let's rule that out. And he went back, had it run again, and same results, same odd issues. And he called me and he said, we can't do this surgery. You need to go see your primary doctor. And it was kind of just left at that. And,
Ooh.
getting a phone call like that at the end of the evening, and you're like, I don't even know what I'm supposed to be worried about at this point. What is he seeing that's abnormal? What does it mean? So that threw me down a rabbit hole for a couple of weeks of going through first to my primary doctor, who of course did more blood work, and then he referred me to somebody else who called me up out of the blue, this doctor I never heard, and he said, how are you feeling? And I'm like, other than the fact that I'm really freaked out because this strange doctor that I don't know is calling me, what's going on? He said, well, if you're okay right now, you can wait till tomorrow morning and then come check into the local hospital and I'll see you there. And I was like, what? How am I supposed to sleep tonight, basically? And what am I supposed to be worried about? So I made it to the next morning, and it was like this whole process of just trying to figure out like what was going on. I had basically clotted off the veins that drain my liver, and they figured that part out pretty quickly. But what was the complicated thing was like what had caused me to clot that off. I mean, I was 25 years old. Like, that's not typical for a 25-year-old to clot off the veins that drain their liver.
Oh my gosh.
So they sent me to a different hospital because I was in a smaller town in California, and it was like, we don't know how, we've no experience opening up these veins, and we don't know, exactly what this is. So we're going to just send you to this major medical center. And it was there that they gave me the diagnosis of leukemia, which I actually found out 3 years later wasn't the correct diagnosis.
You were misdiagnosed with leukemia.
Yes,
Oh
yes.
no. Oh my gosh.
And treated for 3 years.
Oh my, this is why I say when you get a diagnosis, go and get a second opinion, a third opinion, because I think it was the Mayo Clinic did a study, like an internal audit, and they discovered that 70% of the first time someone's diagnosed with something is incorrect, or is then a different diagnosis when they go to the second opinion. And it's like there's enough, I mean, don't quote me, it's some crazy statistic, but it was this enough of a margin of error that, like, I think it should be standard practice to go to multiple different doctors in different medical centers, get another battery of tests, because I mean, you were misdiagnosed and mistreated for 3 years. So what did they give you? Like chemo, radiation?
Luck,
What did they give you?
luckily, it wasn't either of those.
Oh,
There was
good.
like for the type of leukemia, it was chronic myelogenous leukemia, and they had like a new medication that was specifically like a pill to target whatever the genetic abnormality was. So I took this medication though that was like really expensive, and which had all sorts of other lovely side effects.
Right? What were the side effects?
One of them, one of the worst ones, was it just had a lot of nausea. Like, I would try and time it, to my meal in a certain way, and some of the time it was just like I would just get really sick, and I started losing all of this weight just because I was like, eating wasn't really very fun. I didn't know if I was going to wind up throwing up after I ate dinner. People would even say to me, like, don't, they thought it was like, oh, you're on a weight loss thing. Like, don't lose any more weight. I'm like, I'm not exactly trying to lose weight. I just can't maintain any weight.
Wow. So how did you find out you were misdiagnosed?
It took a while. I mean, I think deep down inside from the initial diagnosis and over the first year or so, like, I felt like something didn't match. Like, I just had that intuitive knowing, but I couldn't get anybody to listen to me. And I kept asking my primary doctor, I said, would you refer me to a different hematologist? I don't trust this guy. Like, I'm not comfortable. And he was like, oh no, we went to medical school together. He's great. And I was, at the time, I was on a student health insurance, So I had to get a referral from him, and I wasn't getting it. And so I found myself kind of in this trap of, you know, not being able to get a referral to somebody else. It was only when I actually realized, hey, I'm miserable and I'm going to quit this program and just go get a job that has health insurance. And I did, and I got a different primary doctor outside of the student health clinic. And I said to her, I don't want to see this hematologist anymore. And she said, here's a referral to somebody else. And immediately, like, I remember that first appointment. I mean, I brought in probably a stack of medical records that was about 2 inches thick. I had everything, all my labs, everything just like copied, and I brought it to him, and he looked at it and he said, this doesn't look like chronic myelogenous leukemia. And I was like, finally somebody's
Oh my
listening to
gosh.
me.
Now, how did you ever go back to your old primary care physician and that old hematologist and like rub it in their face?
I actually went through a medical malpractice case
Nice.
a couple of years later, although it didn't end up the way I would have liked it. It
Oh.
ended up in a hung jury. But I mean, for me, the case was more about just like holding them accountable. It wasn't necessarily about, I want millions of dollars, but it was like, you should never do this to some other patient ever, ever again.
Exactly. So, okay, so now you're seeing this new doctor and they're like, well, that doesn't look like what you've been diagnosed with. What did it look like to him?
It was a different type of blood disorder because technically, leukemia is a blood disorder. It was something I had never heard of before called polycythemia vera. And that's just basically, it means that you make too many of the different cells in the blood. So you make too many white cells, red cells, or platelets. So the way the doctor explained it was like, think of there being like a light switch, and the switch that basically tells the body, don't make any more of these cells. We're good. We've got enough. It's just broken. So the body just cranks out all of these blood cells, even though it's like you have plenty of them.
So you were making too many platelets.
Platelets, white cells, and red cells. So my blood is just like really, really thick.
So how do you what, just donate blood a lot?
That's part of it. It's, like a therapeutic phlebotomy, which, they can't use the blood for anything. They can't give it
What?
to somebody else. Yeah, it sucks because it's like, here you see people getting infusions of, blood and platelets. And I'm like, I got plenty of those. But because of it, not being kind of a normal thing, they don't use it for anybody else. They just take it and throw it in the medical waste
Oh
bin.
my gosh, there's like the homeless and needy. Here, have my blood. It's a little irregular, but
Exactly.
it keeps me alive. Uh,
Exactly.
wow. Well, that's, therapeutic phlebotomy is so much better than, cancer drugs.
Yeah, yeah, it is. I mean, I do take a medication also that helps to suppress the cell lines, and then I also use the healing work that I do to
Nice.
continue to work at it at the root. I mean, some of it they think is there's a genetic component which takes a lot longer than things that aren't, to try and, clear it and heal it. But I
Mm-hmm.
have seen changes. Like, my spleen used to be so enlarged it was almost down to the top of my pelvis. Um, and now it's pretty much like in its normal place. I've gone to the doctor several times, and she's kind of felt the edge of it, and she's like, it's all the way up here, like where it almost should be.
Nice. Wow. Okay, so how long did it take her to figure out that that this is actually what you have?
As far as the doctor who made the correct
Mm-hmm.
diagnosis,
Yep.
I mean, he kind of knew it in the first appointment. And then he said, of course, I want to run some more tests. I need to do another bone marrow biopsy, and I need to, make sure what it is. I think he sort of had a guess of what it was, but, he needed to do the testing to figure out and confirm what he thought it was. And that was within probably a couple months, and maybe even a month.
What a relief to get off that medication that was making you sick for 3 years.
Yes, very much so.
Absolutely. So, okay, so now you've got the correct diagnosis. You must be feeling so much better at this point. Um,
Yes, yeah.
what did you do next?
Well, it was actually through kind of this whole process. I mean, even though I wasn't getting a doctor to give me a different diagnosis and I couldn't see a different doctor, about a year and a half into the process, after my best friend actually passed away very, very suddenly, and I went through kind of a major depression.
Mm-hmm.
As I came out to the other side of that, I started exploring all sorts of alternative healing. And so I started out by going for biofeedback, which is just basically, getting hooked up to a computer and seeing on screen, what your heart rate is doing, what your muscle tension is doing, all of those things. And I got really intrigued by that. I started learning more about yoga as actually a form of healing, not just my preconceived notion of it being like people working out and, putting themselves into pretzel positions. And then I found an acupuncturist, and so I started really like dabbling during that time period, and like what can help me besides this medication that's making me sick, and I feel miserable. And I started to realize, besides being caught in this trap of Western medicine and not being able to get a different doctor, I realized that no matter what, they didn't really have all of the answers to make me feel better.
It it is that realization that empowers us the most.
It
It
really
it's
is.
when we give up our personal power, when we put a doctor on a pedestal, or and it's how we were raised. We were raised to be obedient to teachers and adults and the people in authority, right? To do what your doctor says. And I've had the people in the older generations kind of scowl at me and say, just do what the doctor says. Just obey the doctor. And I'm like, no, that's not, they're human too. They're not, perfect, and they're going to make mistakes, but their mistakes can cost me my life or the quality of my life. And drugs are not safe. They're dangerous. They're chemicals. They manipulate the body, and um we need to see a healthcare professional that wants us to ask questions, that is excited to help us explore alternatives and to look deeper, instead of just spend 15 minutes with us and then give us a prescription.
Mm-hmm.
And we need to interview a doctor. We need to go and see as many doctors as we can and interview them and find the one that we feel is a good fit for our team, that doesn't want to be put on a pedestal but wants to be a part of our team, that serves us, and that is okay with us saying no to them, asking for alternatives, asking different questions, and wanting what's called informed consent, where we learn all the good and all the bad about a particular kind of medication, for example, like vaccines. There's also so many doctors that just want to talk about the good and then get really angry at you if you want to bring up any of the bad. It's like, no, vaccines aren't perfect. There's bad too. We need to talk about both sides of every, when it comes to any medication or any treatment plan. And so I love that you started seeing that, doctors aren't these people we should put on pedestals. That, I mean, they want to help us, but they're not perfect. And
Exactly.
we are the ones that are in our own body. We should be the experts of our own body because we're listening to our body. So we need to become accountable and responsible and start listening to our body so that we can make the correct informed choices.
Exactly. Yeah. If we don't, we're giving up our power, and we're not making informed choices. We're just kind of trusting them blindly. I mean, all you have to do is listen to a drug commercial, and you hear all of the side effects that they list at the end that, they're hoping you just kind of tune out as they go through them that quickly.
May call
Uh,
anal leakage, may cause anal leakage, may cause death, may cause suicidal tendencies. I have a really good friend. She's currently living in Texas, and her daughter was put on a drug that stops seizures. Her daughter, they finally diagnosed her with a brain infection. She's had some kind of slow growing brain infection for a few years, and they finally got a neurologist who discovered it and put her. But so while they're cleaning up the brain infection, they have her on this drug for these horrible seizures that she's having. She's about 13 years old, right around there.
mm,
And Three, and this daughter, now this girl has been homeless twice. I've known her since she was 6, never seen her depressed. She's always chipper, always happy. She's always like, they'll her mother will have no food, no money, no, not a house to live in, and they'll be in a shelter, and the daughter is happy and cheerful, and she just keeps her mom happy and goes, you know what, there's something good around the corner, let's, she's always looking to help others. Like, she's just the epitome of happiness and an enlightened being. 3 days into this medication, she goes, mom, and she points at, so there's like a list of side effects, she points at the like suicide, and she goes, mom, this is the side effect I'm having right now.
Mm.
And she was depressed. 3 days into a medication, she said, mom, I don't feel like there's anything worth living for, and I want to kill myself, so I'm letting you
Wow.
know. 3 days into a medication, that the one of the worst, obviously one of the worst side effects, the suicidal tendencies. And
Mm-hmm.
that's not part of her being. But thank God she's someone who listens to her body. Because what if someone gets on a medication, they don't listen to their body, and now they start having these thoughts? They might follow those thoughts to completion,
Yeah.
not realizing that it isn't them, and that's not life. That's a side effect of one of the medications.
Yeah, it's wonderful that she was able to say that to her mother too, and realize, consciousness, like,
Yes.
this is not how I should be feeling. Like, I'm having these feelings, but this isn't me.
Exactly. 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 We have to listen and get, feelings are not facts. Emotional feelings could be coming from something else, but it's not the end all be all. And then listen to feelings also from the body, and go, well, where is this coming from? Let's explore that. So you started exploring this, and you started going, well, I need to start listening to my own body. How did you come about that? How did you come about discovering, diving deeper into listening to the body?
I think, the first part of it just started with I actually, when I was so depressed, I was in an inpatient mental facility for 5 days just to stabilize my severe depression. And as I came to the other side of it, it's interesting. I don't think I consciously realized what I was thinking, but as I was writing the book that I wrote this year, I realized, I was just terrified because I didn't know how to process any of the things that I had been feeling for the past year and a half. Like all of the grief and the fear and the overwhelm, and, just like having this diagnosis just thrown at me, like this huge boulder that sat on me. And then, my friend passing away. And it just felt like everything in my life was just falling apart. And, while there was a moment there in my story where I felt like I wanted to die, I realized that I didn't want to die. I just didn't know how to handle everything. I had no tools to process it. And so, part of that was just going to a therapist and talking to them about how I was feeling. But I also was fortunate to have a therapist who kind of encouraged me. Like, she was the one who told me about this class that was called Yoga for Healing. And I was like, seriously? Like, you want me to go to this class? I don't know. The only yoga experience I had ever had was at a gym. And, it was like, I didn't like it. It didn't feel good to me. It wasn't how my body wanted to move. And she's like, no, 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 it's different. Just go to this class and you'll see what I mean. It's very, very different. And as soon as I went, I was like, oh, okay, I get it now. Like, it was more about lying on the floor and breathing. And, it was very restorative yoga with bolsters behind you. And so I started to just realize there's so many more things out there. I mean, I grew up in a small town in Idaho. Like, I never had exposure to a lot of these things growing up. I mean, I knew there was something called acupuncture, but I never would have gone and seen an acupuncturist before.
So in these yoga classes, you did you identify that meditation was helping you to release the pain, that it was helping you to get in tune with your body or your emotions? Like, what was it that was really helping heal you?
I think what really was helping heal me was just having that quiet time, like to really listen to my body, to breathe, to be present, to find things that felt positive and good in my body at a time when everything didn't feel very enjoyable and didn't feel there was lots of pain or other symptoms. And the teacher really, because she had actually worked a lot with people with cancer and stuff, that was very much her focus, was just, helping people find ease and comfort in their body and develop a different relationship with it.
So then what happened? So you were taking these classes and you were beginning to feel and connect with your body and your emotions. Was there an aha moment? Was there a breakthrough? What led you to what you do today?
One of the first breakthroughs for me was actually in a biofeedback session, and I was sitting there, sitting with the practitioner I was working with, and I had this moment of like, I could see myself sitting in her chair. I
Nice.
could see myself doing this with somebody else, maybe not right now because I'm still deep in my own healing, but I could see myself as I moved out of that kind of really intense healing to a place of wanting to help others. And then I kind of started to feel the same way about the yoga. I was like, oh, I could train in this and I could let this be something that I start to bring to the world. And so everything that I do in my work with clients are things that I personally had found very beneficial for myself. I've never kind of just trained in something because I've heard of it, but it's like first I've had the experience and I resonate with it, and then it's something that I go for more training and learn how to do as a practitioner.
Very cool. So then what happened? So you just did you dive in and start taking these classes?
Yeah, I did. I mean, kind of, I think 2007 was sort of like a pivotal year for me. It was the year that I officially stepped out of the graduate program because I had a job and I had health insurance. So I could, I had to kind of stay in my program like on leave basically so I could still have insurance because of the wonderful insurance system in this country. And so I got insurance, medical insurance, left my graduate program, and then realized that I wanted to start pursuing these other things. So then I started I went to a psychology program actually and studied for 2 years to get a master's in that because I felt like, okay, I've spent all these years studying history and now I'm saying I want to work with people, but how am I qualified to be able to do that? So I went and I found it was a really specialized program in something called somatic psychology. So not just focused on kind of the mind piece, but actually honoring the fact that there's that interconnection between the body and the mind.
Very cool. Can you give us some examples or like did you have like a specific experience, or can you give us something so we can sort of begin to understand it for ourselves?
Kind of what somatic psychology is.
Yeah, like or just an example like of how did you experience it specifically?
So for me, one of the things, I mean, there's so many different like sub kind of schools under that because it's kind of like an umbrella term. I found and I got really intrigued by combining dance and therapy because there's something called dance movement therapy that I had never heard of before. And I've been a dancer since I was small. And I was like, oh, this is really cool. Like I can actually use dance in a way that's therapeutic and that actually heals, emotions and heals different things. And so it was really, that was kind of, I think one of the big things in being in that program was just, I saw the buffet line open up even more. I was like, wow, there are all these different things I've never heard of, that all these schools and approaches that I could, choose from at this buffet. And even though I knew I didn't want to be, a lot of the people in my program were there because they wanted to be like a counselor or a therapist. And I was like, I don't want to just sit and talk to people. Like I want to do something really, really body based and have that kind of just be the background and framework for it. So that was when I started kind of adding in my own focus of like I trained in biofeedback and I learned how to be able to facilitate sessions doing that. I trained in the therapeutic yoga. And then I kind of went out there and started practicing. And about 5 years ago, I encountered something called BodyTalk. And I'd never heard of it before. And then I met this woman who was a practitioner at a networking event. And she said what she did. And I was like, oh, that sounds really cool. It sounds kind of up my alley. But I was like, I don't really feel like I need to go make an appointment with her right now. But I remembered her a year later when I developed this pain out of nowhere in my left knee. And I was trying all of the things I already knew that were holistic. I didn't reach for, pain medications. I was doing yoga therapy and I was getting acupuncture and chiropractic and massage. And my knee was like, nope, still not going to heal. And I thought, I keep telling people I feel like my knee was like talking to me, but it felt like kind of that Charlie Brown teacher, wah,
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 wah, wah,
wah.
wah. I'm like, I don't understand. What are you saying? I want to know your message. And so this woman, it was kind of like the little mental Rolodex in my brain, like her name kind of popped up. And I was like, I don't know, this thing called BodyTalk that she told me about, maybe she could translate for my knee. And I went in for the first session and it was just amazing how quickly she got to the root of what was going on. She helped me understand that basically she said, what happened right before this pain came on? And I was like, well, my parents came to visit and my dad was going through a mental health crisis and he was seeking a second opinion. She's like, you have some unresolved trauma from that. I was like, oh yeah, that makes a lot of sense, but I hadn't kind of put two and two together for myself. I was just like, oh, they went home and now I need to work. Now I need
Right.
to, do my business. And my body was like, no, you need to actually stop and process what just happened because you're still traumatized by all of the things that just happened in the last 2 weeks.
Right. Yes. I learned about there's a book called Healing Back Pain, and it's really interesting. People, all these people were getting surgeries and then they did follow-ups and they discovered that the back surgeries weren't working, that even though they removed the whatever was it, like the bulging disc or whatever, the person still had back pain. And what they discovered was that this is might get be woo woo for some people, but unconsciously, when we consciously suppress and don't deal with certain emotions, it will manifest in the body because the unconscious mind's going, I'm still here and I need to process this. And it'll create a tension in muscles so bad it causes ischemia. So meaning it blocks blood flow to certain muscle groups,
Mm.
which will refer pain a lot like you could Google trigger point pain, a trigger point pain chart, and it might radiate down the leg or down the arm, or there's trigger points in the neck or the chest that'll mimic um a heart attack. And people think they have heart attacks, but it's actually the body creating a tight band of muscles near the innervation point of the nerve and also near the blood flow area. So it can create extreme pain, but there's nothing wrong. And the tension is is muscular tension, but it's muscular tension created by something unconsciously unresolved. And I had a client back in 2005. She was one of my first clients after I became a master practitioner of NLP.
Hmm.
And she came to me with back. She was a long distance runner and she had back pain. And she came to me for her anxiety and a few other things, but she was always on pain meds and she didn't want to be. And so we sat down, did a detailed personal history. And I used to be a massage therapist in Canada, which is a lot like physical therapy. So I asked her if I could palpate her back, and I discovered that her um, right quadratus lumborum, which is the square shaped muscle in their lower back, was cold as ice and hard as a rock, so no blood
Hmm.
flow. And then the
Right.
quadratus lumborum on the left side was nice and warm and malleable. And I was like, dang, like, and that was at the beginning of our session. I went, her brain is suppressing something, or she's suppressing something that she's not dealing with, and her body is manifesting it in the physical. And so we went through like, through the course of a whole day, we went through a whole session where we just, dove deeper and deeper and deeper until we discovered that she had a huge amount of guilt. And
Mm.
once we addressed it, her and I would always ask every like 10 minutes or so, where's your pain? Like, where's your pain on a scale of 1 to 10? And once we identified every time she felt guilty, her pain went up. And as we talked about things, and once we addressed it and resolved guilt, the pain went completely away. I touched her back, like the blood flow came back. And it was like I learned all this stuff on paper, in a classroom, but I'd never seen it actually like take place like with someone. And I was like, oh my gosh, this stuff works. This is crazy. It actually works. And since then I've seen it so many, but every time I see it work, it still is like magic, right? It's still totally like
Mhm.
magic that you can help someone resolve or get in touch with and resolve emotional issues, and that these things in the body that they've been medicating for, that they've gone to see doctors and had tests for, gotten MRIs for, and like scheduled surgeries for, can resolve because that they
Mhm.
didn't need a surgery or a drug or whatever. That their issue, the root cause, was that they were suppressing their emotions and not resolving. And so I just love that you discovered that about yourself. So what did you do? How did you go about resolving that unresolved trauma that was manifesting as knee pain?
It was actually in the course of this healing session that she
Nice.
facilitated something. In Body Talk, we call it an active memory technique. So it basically kind of helps the brain process and then dissociate whatever trauma and emotion is left from that experience. So you kind of like have to think about it for just a little bit of like, I went back into my parents are here. My dad is like, doing really poorly. He at one point he almost jumped out of the moving car. I don't know if that was like a conscious thing or if that was him just not really understanding what was happening and being in a panic and just
Mm.
like, I want to get out of the car.
Mm-hmm.
So I had to go back into that moment of it and then, do these eye movements to help my brain clear it. And then, I mean, it was amazing to me, like you're saying, in that very first session. I'd been working on trying to clear this pain for probably about 3 or 4 months when I finally tried this healing modality. And after that session with her, I would say it was at least 95% gone, and my mind was just completely blown that it could shift that fast. I mean,
Yes.
I had seen things before, but I was like, whoa, like how did that just happen?
Wow. So that was your I want to learn this stuff and do this with people moment.
Yes, very much. I was already like using some other systems, and doing the yoga therapy, and I was kind of pursuing that path. And I was working with people with the biofeedback and having them hooked up to computers and kind of teaching them how to breathe and how to relax. But then I was like, this thing, like, how did she know that I had this trauma, and how did she know all of these things that came up in the session? And I just became kind of like hooked on it. I was like, I need to go for more sessions. I want to know what this is. And then she's like, well, there's a training also coming up in a few months. And I'm like, sign me up. I
Very
want to know what
cool.
this magic that you're doing is.
How's your dad now?
He has improved a lot. I mean, he's kind of had some behavioral changes in the past 5, 6 years. Um, but, or maybe even it's been longer at this point, but he's much more stabilized than he was at that point.
Have you been able to
So
do any body talk with him?
I have, yeah. I work with actually both of my parents, although in some ways, receiving sessions from somebody who's your own child, it's
Yeah,
like
I
it's not
changed
as
your diapers.
it's not quite the as clean as, like sometimes I say to people, it's better if you don't work with the family member, just like they say, doctors shouldn't treat their own family. It's kind of that similar idea that you're too involved in
Right.
it. So, like
Yeah.
with my husband, I'm like, yeah, you should see this other practitioner that's not me.
So you took the classes.
hmm
Then what happened? Did you hang up a shingle and start working with people?
I did. I started first just bringing it into the other work that I was doing with clients. And then as I started to see how fast I could get results doing things that way versus all of the other things that I was doing, I was like, okay, this is going to be my main thing because who doesn't want to get the results? I mean, people like to get results quicker, and it's satisfying as a practitioner to be able to help people do things that before maybe it took me several months, and I'm like, now I can do it in 1 or 2 sessions to shift some of the stuff.
Mm-hmm. So cool. So when someone comes to see you, how many sessions do they normally need before they're resolved? Before their stuff is resolved, they become enlightened and they vibrate to a new dimension. I mean, I don't know, like there's no real end point, right? Because like you peel back the
Exactly.
layers, you're like, okay, I've now dealt with all my trauma in the first grade. Now, now let's deal with the second grade. So,
Exactly.
how long does someone need to see you? Because I know Freudian therapy is about 200 hours of lying down, talking about your childhood, and that doesn't work for everyone. Freudian therapy
Right.
is, it's just like I wouldn't say everyone should go to an MD. Not everyone's going to get results. Some people should go to an osteopath. Some people should go to acupuncturist or chiropractor. So same with the dealing with our heart and our mind. There's so many different therapies. Like I love Jungian therapy, much over Freudian any day.
Hmm.
But then you get into like cognitive behavior and behavioral psychology, and then you get into all these what you're doing, which is like the real fun, like connecting neuroscience and biofeedback and listening to the body. So, um, how long does someone typically see you for? Do they go like weekly sessions for 5 sessions, or is there an endpoint where you graduate people?
I mean, the end point sometimes just depends on them, like when they get to that point. Like, I mean, personally for me, this is part of my own healthcare. So it's like, even if I'm not working on some big issue, I know that I'm going to have kind of maintenance, like you would go, for something else, like, occasional acupuncture or massage. But typically, with most of my clients, like when I'm working with somebody who's coming to me with something like a chronic illness, an autoimmune disease, something like that, I tend to work with people over the course of about 6 months, sometimes up to about a year. But that's not every week. Usually I see people about twice a month. So, it's a period of time because there's integration between sessions that the body kind of has to process whatever came up and whatever it's shifting before we can kind of get to the next layer, so to speak.
I love that you brought up autoimmune. So something that someone would think has nothing to do with the mind and the heart. It's the physical body. What are you talking about? Can you please explain why healing and resolving and releasing trapped, unresolved negative emotions in the body would help someone also to heal from autoimmune disease?
I mean, I think one of the big things with a lot of people with autoimmune disease, if you think of what it just represents in terms of what is your immune system doing, it's attacking your own body. So there has to be some component of how we think about ourselves, how we feel about ourselves. That's part of that. I mean, is there some deep-seated kind of self-loathing or hatred, or maybe it doesn't even rise to the level of that, but there's something there that's causing your body to attack itself.
And after someone's worked with you for, let's say, 6 months or a year, do they see improvement on their blood work? Can they see something physically getting better through healing their emotional and mental state?
I've never had somebody exactly always come back with their blood work results, but a lot of clients say, like I have one client that significantly decreased her pain medication for several autoimmune diseases. And she was able to completely go off of one medication that she was taking, just seeing incredible improvements in just daily energy levels. So going from like being able to do one thing and then you have to take a nap and, then maybe you're kind of done for the rest of the day, even with the nap, to being able to like almost have a normal day. So I tend to hear more from people kind of their qualitative experience of what's happening more than, hey, this particular lab. But that would be very actually interesting to see, have somebody with an autoimmune and have them have those particular blood tests done at the beginning. And then, at the end of the 6 months, what does it look like? Because there been a decrease in some of those inflammation markers.
Absolutely. Because what you're doing, I mean, one of the side effects of what you do is you're helping to lower stress levels, and you're lowering cortisol, and you're taking them out of the fight or flight mode and bringing them into the rest and digest mode. So there's a whole thing. Your body is turning on its healing response, and so that obviously is helpful. So tell us more about body toxins. That's the main thing that you do. I mean, I know you have all these tools in your tool belt because, like a good healer, You stock your tool belt with many tools, and then use the ones that work the best for each individual person. So Body Talk, as you said, is your most commonly used tool. Can you give us a rundown? What exactly is it, and how does it work? So, like I had mentioned about, the fight or flight response, that you're turning off this fight or flight response automatically when you get people out of stress mode, when you get people releasing negative emotions. And so that right there is only one of many reasons why you're helping people to decrease their pain or get off pain medication completely. Um, I'd love to understand what body talk is and how does it work. Bring some and
Sure.
you can bring some science in. We got a lot of people who are healthcare professionals that listen, so if you have any scientific explanations as to how it works, we'd love to hear them.
Okay. So, kind of just the basic premise behind it is just understanding the story that the body is telling through the symptoms. So, that could range from anything like, the immune system. Maybe you're having an allergy to something you ate, kind of like your friend with the tofu that was causing these symptoms. It could be something with kind of the energetic part of your body, like the meridian system from Chinese medicine, out of balance chakras we work with, like I said, those active memories, those memories that still have an emotional charge to them, emotions that are stuck. And so it's basically the body is telling its story to the practitioner, and then I'm kind of sharing that story, like, this is what your body is communicating to me about why you're having these particular issues. And it's, again, that kind of layer by layer process. This is what we're ready to work on today, and then the next session, what's the body ready to tell us today? And we just kind of keep going and keep going through, kind of like the layers of an onion, so to speak. So I think one of the best ways to understand also is that there's a lot of approaches, especially Western medicine, where we're very focused on kind of the symptom, which, if you think about kind of the idea of an iceberg, that's kind of what would be visible above the waterline of the iceberg. But what's underneath the waterline is a lot bigger in an iceberg. It's that the large mass of the ice. And so we're much more interested in diving down into that layer of, all of those things. Why are you having this autoimmune issue? Why are you having this chronic pain in your body? What is your body telling us? What are all of the experiences in your life that have contributed to this? And we really allow the body to tell us the sequence that we need to go in. So I think that's one of the other things that's really cool about the system. A lot of approaches have, it's like, we have a protocol for, you're getting migraine headaches, so we'll treat you with this particular way. And this is much more kind of following the lead of the body, like what
Mm.
needs to shift first. Because sometimes what we think consciously, it's like, oh, well, that has to do with what happened when you were, 10 years old. And it's like, well, maybe it does, but if you address that first, you're missing something else that needed to shift before you could really resolve that memory from age 10.
So, could you tell us a bit about the history of Body Talk? Who created it? When was it created? And how did it come about?
Sure. So Body Talk was created by a man named John Veltheim. He's from Australia, and his background was as initially an acupuncturist. So he ran actually an acupuncture school in Australia and had a busy practice. And then he also had studied chiropractic. So that was his initial background. And he's gone on to study so many more healing systems than that, but that's where he came from. And the work actually in the beginning came from his own process of healing himself. He had Epstein-Barr, and he was becoming really debilitated to the point that he couldn't run his acupuncture school, he couldn't run his practice, and he, didn't know how else to find healing for this. So he went on this process of trying all these different things and studying all these different things. And he did heal the Epstein-Barr for himself. And he took kind of the pieces that he learned, and that was kind of the beginnings of the Body Talk system, which is constantly growing. He's actually still a very active player in the system, creating new courses and creating new pieces. He's just always putting new things out there. I mean, he's a fascinating guy, and he's always sharing things of, learning more about quantum physics, because part of the system is actually based in that idea of like observing. So me as the practitioner observing what's coming up for the client in the session is actually part of what catalyzes the change, because we need to have that witnessing of this has to do with, this particular traumatic event or these emotions that are stuck in your body. It just doesn't have the same power if we're not having that observer.
Can you speak more to that? Can you get deeper into explaining how you as the observer become the catalyst for their change?
So it's really, I guess, the part of it is my focus. So like I sit at the side of the table if somebody's in person with me, but I also work at a distance, and I'm tuned into their energy, and I'm asking, okay, what is the priority today to address this issue? And I'm using muscle testing and my intuition to kind of navigate a protocol chart. But then with what comes up, and when we do what we call tapping it out, which is just a simple energetic tapping, it's not the same as EFT, but it's using, energetic tapping over key areas of the body, the head, the heart, and the digestive system to integrate that. But if I'm not really focused and I'm not really present with what's come up in that session, then it doesn't have that same effect. So it's like I'm helping to shape what's what's shifting for them by observing that and really holding that in my focus and my intent, like these two things need to release and these two areas of the body need to talk better with each other.
And what's the patient doing at the time that you're tapping them and focusing on them and listening to your intuition?
So usually they're just lying, breathing. Sometimes, if there's a active memory, a memory with that charge to it, they have to kind of think about it and maybe do some eye movements, if that's kind of where we're going with that. Sometimes they're holding a particular area of the body that we're bringing focus to. Like if the liver came up a bunch in a particular balancing, it's like they may have a hand on the liver and just really holding that area with their physical touch, and then I'm bringing kind of my mental focus on it and just observing, okay, these are the things that the body said that need to shift. So it's kind of based on those experiments that they've done in quantum physics, where it's like if you expect something to behave like a particle, it does, and if you expect it to behave like a wave, it does. So it's like I'm kind of using that focus of like observing, okay, this is what your body said needs to shift, and we're holding space and just allowing the body. I'm not really doing anything other than observing and focusing.
I've had that experience before with my friend of mine has a wiener dog, and all of a sudden its back legs stop working, and the chiropractor, the vet said, these happen with wiener dogs because they're so long, and it may not never walk again. It has an impingement in their back, and it's kind of like, you know, go home to die. We don't know. And we were petting it and holding it, and we had just sort of learned about this idea of using the idea of quantum theory in the modality of healing. Sort of like
Mm-hmm.
Schrodinger's cat. Like, is it dead? Is it not dead? It's that, when we focus on a diagnosis, how much energy do we give towards that diagnosis
Mm-hmm.
instead of towards the healing? And so we did some Reiki with him, and we held him in the space that he is going to get up and walk. And we both
Mm-hmm.
imagined it, and we kind of, I know this sounds really woo woo, but we held him, and we sort of had visualizations, like we were just, if we could psychically send him a message, send this little dog a message, it would be, heal thyself and walk again, and you're going to be okay. And what was we started I was talking to the dog's owner, because she just broke up with her girlfriend, and they all live together, and so we were like, well, maybe the dog's like reacting to the fact that there's like this trouble in the household, because
Mm-hmm.
animals are very sensitive to that. And so we just kind of gave it a bunch of love and told him that he's, held him instead of holding on to his diagnosis, which the vet was pretty sure the dog would never walk again, that the impingement was like something major. And then after, we just really gave him some attention, some love, some Reiki. So we didn't do any physical manipulation, but we held him in this space of Schrodinger's cat's alive in that box. We're gonna change this. And he got up and he walked, and he was fine. He never had that problem again. And it really had us sort of question, like, how much does our, running around in life without ever stopping to go, well, okay, negative things happened. I didn't even stop to breathe. I didn't even stop to take a breather. Like my parents
Mhm.
get a divorce, or, a friend passes away, and we don't stop to, or we get fired from a job, or something happens, and we don't ever stop to just pause, take a breath, and process it, and allow ourselves to process it. And sometimes it takes seeing an illness in someone else or in an animal to go, oh wow, like look how much I'm not taking care of myself. And it had us go, wow, there's something to this, how much we project into the world. Like if we project onto, for example, this dog, that it's sick and it's never going to get better, our behavior towards the dog would be different than a
Mhm.
projection of a belief system, projecting onto the dog, I believe you're going to get better, and I'm going to like love on you and treat you like you're going to get better. And what about how we treat our own body? If we believe in a diagnosis like diabetes, right? There's 1 in 3 people in the United States have pre-diabetes or are diabetic. And so if
Mhm.
they hold on to that diagnosis, like if the doctor said, well, you're going to have diabetes soon, and they held on to it, and then they start just treating themselves like, well, I guess I'm just going to go to McDonald's because it doesn't matter. I have this diagnosis. I'm diabetic, or I'm going to be
Mhm.
diabetic, whatever. So the image in our mind, the reality that we hold to ourselves also will dictate our behavior, which dictates our results in life. And I know that one of the things you love talking about is how we are not our diagnosis, and we need to shift our consciousness, and like almost like that on that quantum level, we need to go, okay, well, whatever exists, whatever we think is reality right now, we can change our mind. And the
Mhm.
change starts in our mind. So I'd love to dive into that a bit, because I think it's such an important topic for all of us to understand. How can we change our belief system around our own body's limitations to heal?
Oh yeah, definitely one of my favorite topics. I think it's such a huge topic. I'm like, where do I even want to start? um, I think just knowing the incredible power of our minds. I mean, as I was researching my book, I was just reading all of these placebo studies, which I find incredibly fascinating. And I think they
Mm.
really illuminate the power of our minds in our own healing. I mean, there was this one study that I read, and um, it wasn't meant to be a placebo study. It was this doctor who was a surgeon, and he did like knee replacements and like orthopedic work. So he wanted to see which of these two techniques was better for people with knee pain. So he divided the study into 3 groups. One group, they went in and they like flushed out all of the stuff that was causing inflammation in the joint. And then the other group, they went in there and they like shaved down, I think, some of the cartilage and stuff. That was kind of the second way. And then the third group, they did what they call like a sham surgery. So they brought them into the operating room and they made them think that they were having surgery. So this was supposed to be like the control group. But the fascinating thing was what he came to find out was the people in that third group actually got either the same or better results than the people who had the two third types of procedures. And
Yes.
like, there's these videos of these people, like they were playing basketball, they were walking, and all these things they couldn't do before. And it was only like 2 years later, I think, that they told these people that they hadn't actually had a procedure, and they were like, oh, I didn't even have surgery, and my body healed itself. So it was them just believing in the power of this procedure that actually drove the results for them, that their mind actually created a situation to reflect that reality that, hey, I just had surgery and now my knee is going to be healed and I can get back to living an active life.
And then there's also so that's the placebo effect. And then there's
Mm-hmm.
the nocebo effect, right? Where people, like if a doctor doesn't believe that something's going to heal them, and they say, I don't think this is going to work, then if there's a belief it's not going to work, then that actually also influences that it won't work.
Right. I mean, if we believe deep down inside, oh, this is, what's the point? Why should I do this? Why should I do this therapy? Or why should I take this pill? It's not going to help me anyway. Then, our minds are just that powerful, and they're just going to create that same reality. So I think, when somebody is dealing with something like chronic illness and a big, heavy diagnosis, the first thing that's really important is, your doctor is probably going to say all of these things about, your life expectancy is going to be shortened by blah, blah, blah. You're never going to be able to do this. It's like important to realize that that's just what they've seen, but that doesn't have to be your reality. I mean, there's things all the time that doctors, scratch their heads and they're like, I didn't know that was possible.
Mm-hmm.
I didn't know this was possible, because those people have gone at it and said, no, I'm not going to just roll over and say, oh, you told me that I have 6 months to live. And, some people believe that and they die like 6 months to the day. And some people say, no, that's not going to be me. And they live for years and years beyond the 6 months. So
Mm-hmm.
it's really partly about, knowing that, yes, they're coming from a perspective of what they've observed and what they've learned in medical school, but that doesn't necessarily mean that that's has to be what happens to you. Like, you can actually shape things by saying, no, I believe my body can heal, and I believe my body is healing every day.
How can we help to sort of see what's beyond our blind spots? Because the hardest part about having a limiting decision or a negative belief that's dictating our behavior is that we think it's reality. Like, people think their limiting belief is their reality, sort of like the people that have type 2 diabetes that really believe at their core they'll always be diabetic and they don't see a way out of it. When, out of everything I've ever healed in my body, type 2 diabetes was the easiest thing to heal. I could tell anyone how to heal type 2 diabetes. It's kind of like a walk in the park, and but that's my belief system, right?
Right, right, exactly. Yeah, some people, they buy into that, like, well, this is not curable, and I just have to be
Right.
dependent on medications forever. Yeah,
So, and
it's
then they bought into the marketing, and so is the doctor. So, but how do we, are there exercises or anything that you can say to us that would help us to begin to peel back the layers so we could start to see the unconscious limiting beliefs that have been running, that we've let run our life and run our health?
I think sometimes that is the part where you almost have to have somebody come in and help you, because we can't see our own blind spots, and clearing your own beliefs, at least from kind of the experience that I've had, is much harder than if you have somebody come in and actually support you in clearing those, whether that be with BodyTalk or EFT or NLP. Like, there's so many tools out there that can really get in there and just clear those beliefs very, very quickly.
Mm-hmm.
Sometimes you don't even know you're thinking them because they're subconscious. And so that makes it really hard. How do you clear a belief if you're not even aware of it? Because it's running at that subconscious level.
Right, right. Well, and I definitely agree with you. Working with someone that can help see it. Journaling also
Mm-hmm.
can sometimes help people to get clear on, especially if we start to like ask ourselves the right questions, like what do I love about my body, what do I hate about my body, if I could have a magic wand, what would I change, and so and what's stopping me from changing that now.
Right.
And then we go, whoa, wait a second, I am, or whoa, wait a second, because someone who's overweight, who's never been a healthy weight, or someone who's never been physically active, or someone who's never been flexible, believes that they can't be anything else other than what they've always been. And they
Mm-hmm.
don't, and so we asking questions like, well, what do you want and what's stopping you from having it now? I love those sort of like, okay, I'm giving you a magic suitcase full of, unlimited amount of money. What would you do with it? What would you do? And of course the first answer is always like, travel and buy a house and help all my friends. And then eventually they get to like changing their body and changing their health. And then it's like, okay, well, so why can't you do that now? Like, what's stopping you from doing that now? And, and then they go, whoa, wait a second. Well, because I don't believe I can. Okay, good. That's the first thing we got to change.
Yeah, and I think the other key piece there is just that, like, sometimes asking yourself too, like, what am I getting out of this? Because sometimes there's
Ooh.
those hidden silver linings to something, I mean, in some ways when I was really, really sick, and I was not the kind of person that liked to say no to people when I didn't want to do something. Like, it wasn't comfortable. And so I'd be like,
Mm.
oh, I'm too tired, or I'm too sick, or I can't right now. Instead of just saying, you know what, I don't really want to. Like that, go have fun, but that's not my thing. I don't really want to do it.
Wow. Yeah, looking for the secondary gain.
Mm-hmm. Because if you're still hooked into those secondary gains, it is a lot harder to let go of whatever it is that you're trying to heal.
Mm-hmm. Mm-hmm. I knew a woman who had breast cancer and was sick for years, and she discovered that her secondary gain was the only time that her husband was always at home and loved, like, put, like, all just like loved on her and doted on her, and their whole marriage was when she was sick. And when she was better, he'd, go
Mm,
to work and never come home. And so she would rather, because she'd lose her, basically lose her marriage, because he'd be off doing
mm,
his thing. And so the only way that she could have that love that she was craving was when she was holding on to sickness. And so she had to decide, do you want to stay sick, or do you want to, figure out a way to have healthy boundaries and find love in other ways and have a healthy body. So it can be interesting, and a lot of people get very indignant, when you not accuse them, but they feel like you're accusing them of secondary gain. Like, what do you mean? You think I'm choosing to have this pain? You think I'm choosing to be sick? And it's no, it's not about that. It's that we, maybe the sickness happens and then we discover there's benefits. And then
right.
we
Yeah.
like, oh, well, wow, this benefit is I don't have to say no to people because they understand that I'm sick.
Right. I don't have to have the uncomfortable conversations, or I don't have to, or I get the love and attention that I really want that I don't get otherwise. And I
Right.
don't know how to ask for. So,
Exactly.
yeah. Yeah, when I talk about that topic in my book, I'm like, by no means am I like calling you out. I have been there too, because, we all find ways to kind of get that secondary gain in situations. But if you don't bring some awareness to what is that, and, how can you find a way to get that without the illness, it can be very hard. That kind of pushes against what you're trying to do when you're healing.
I'd love for us to experience some examples of or actual steps that you teach. We definitely want to get into that. And then I know that you also love helping people to understand that they're not their diagnosis.
Mhm.
Can I know we've been talking a little bit about this, understanding that we're not, the limiting beliefs, but do you have any specific instruction for those to sort of have that breakthrough moment around them not being their diagnosis?
I mean, I think one of the key things is just realizing that you've gone through a lot of probably trauma and difficult emotions and dealing with the medical profession and in getting a diagnosis. And so it's important first to just recognize that and then find ways to start to let that go and heal it. Because, if you don't first get to that and honor it, that hey, I know when I got the diagnosis I did, that was very, very traumatic. And then finding out it was a misdiagnosis was like another trauma. So just really allowing there to be that space for yourself to honor it is a trauma. We might not think of it initially as a trauma, but it needs to be treated like that. And you need to give yourself space, time, whatever resources to process it. And one of the other topics I talk about in the book is about kind of the language that we use. When I was having a conversation with a friend as I was writing the book, she said, um, I said, it drives me crazy when people say, I have this, or my fibromyalgia, or my lupus, because our words are powerful. And so when you're saying, I have this, it's like you're claiming ownership over it. Or my this, again, it's like phrasing it as well, it's mine. I have it. And the tricky thing is, as I was working through that kind of thought process, I'm like, how do you describe these things without using those words? Because there's just, it's hard to have language about, you've been given. Sometimes it's like, I've been given this diagnosis, but that again feels kind of not quite right either. So how do you talk about a chronic illness or a chronic diagnosis without reinforcing it into your reality with the words that you use?
Yeah, because I have an arm, but I don't have diabetes. Or, like, I
Exactly. I have a brain,
right.
but
I want to have an arm, right? I want to keep my arm. I have an arm. And I have two arms, in fact. But so how do I talk about diabetes? I mean, I'm just saying hypothetically, let's say I still have it, which I don't. I was able to resolve it, no longer have it. Um, but in the past, I would say I am a diabetic, but that's like saying, I am a
that's who you
woman,
are.
right? That I'm a
Right.
woman. That's who I am. I identify. I mean, I don't identify as a diabetic. Like, how do we talk about our disease, the disease we're currently dealing with, without in giving it any more power, or making
Done
it
it
part of
already.
our, because the second it becomes part of our identity, it's even harder to look at the actual steps we can take to no longer have it.
Mm-hmm.
And I've seen people like, I have seen people no longer have cancer, arthritis, high blood pressure, adult asthma. They no longer have it. MDs will say you'll have it for the rest of your life. You're on drugs, or you're just in remission, but it's going to come back. No, 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 no. You can change your life and no longer have these things. Autoimmune disease, I've seen people resolve. MS, I've seen MS go completely away using natural medicine. It's not coming back. But MDs will tell you it's, you've got it. It may go into remission, but it can it can come back, and this is your diagnosis. Like, you're a woman or you're a man and you're a diabetic.
Here's the label that's going to hang around you for the rest of your
Right, it's part of
life.
your identity. So how do we discuss a disease without discussing, without enforcing an identity?
Mm-hmm. And in writing my book, I was like, I don't really have a completely satisfactory way to easily talk about it, without using those words. I just know I don't want to use those words.
I could say something like, my body is currently healing from diabetes.
Yeah, and that's kind of what I think I came close to saying. Like, I am, currently, living with blah, 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 but I believe in the infinite healing potential of my body to heal from this.
Right.
But your way of saying it was a little bit shorter, so I like it.
Well, oh, no, thank you. I'm not gonna eat that cake. I'm right now currently healing diabetes, and soon I will have healthy blood sugar. And part of that program is to say no to your cake, but I'm gonna say yes to the seconds of those delicious sweet potatoes and steamed vegetables over there. And so
Exactly.
we can say it in a way that it becomes part of our, enforcing our boundaries. Because
Mm-hmm.
especially around food, you go to a friend's house, or a relative's house, and they're going to push unhealthy foods on us, and then it becomes like this, you're rejecting them. I mean, I've seen this in families where it's like they feel rejected or hurt, or you don't want them to feel rejected or hurt, or there's like love, you know is mixed up with food. And so
Mm-hmm.
you go to restaurants, or go to, like, I actually know people who will order bad food for them, knowing it's bad, like the food they're allergic to, because they don't they the embarrassment of inconveniencing the waiter to ask them to not, like, remove the cheese on top of the, you know on top of the beans, or the cheese on top of the salad, would be too embarrassing and too inconvenient for everyone. And so they're just
Mm.
gonna suffer, right? And it's like, lady, you need some boundaries, right? Because
Yeah.
because it's your body, and you're the one responsible for your own health. And I want everyone to feel empowered to be able to say no, but in a way that doesn't create any emotional stress for themselves and for others. I like the one, I
Mm-hmm.
learned this from a past guest. um Instead of saying, like, I can't have that, like, if someone offers me gluten or dairy, or meat or whatever, oh no, I'm a vegan, I'm sorry, oh no, I'm gluten free, or oh, I'm dairy free. That automatically starts a fight, like a food fight, like,
Mm-hmm.
where the person, like a relative especially, or a friend, is going, well, but this is good for you. Don't you know you're supposed to eat this? Or, it just starts a fight. And a previous guest said, instead of telling them that you're gluten free or dairy free or whatever your food restriction is, and that's the reason why you can't have it, just say, oh, no, thank you. It doesn't make me feel good when I eat that. And all of a sudden, now you're enforcing your boundaries because you're enforcing
Right.
your boundaries. And how can anyone argue with it doesn't make you feel good to eat that? That doesn't, when I eat that food, I really don't feel good. I'm just gonna take that food over there. Thanks. And boom, end of discussion. They can't possibly argue with it. Now you're making healthier choices for yourself, and you're not worried about what other the arguments other people are gonna bring up. But yeah, this is good. The understanding that our language, how we talk about it, how we, identify or not identify with our diagnosis is really important, because what we want is to take actionable steps to heal at all times. And if we're talking about our diagnosis like it's hanging around, like our, you know, sexual orientation, or our, the color of our skin or whatever is not changing anytime soon, or, I was born a woman, it's not changing anytime soon. Those kind of things that become part of our baked into the cake, part of our identity. And then all of a sudden now we're given a diagnosis and it becomes part of our identity. Well, that's not going to change anytime soon. But if it's not part of our identity, then we can change it. So I love that you teach that in your book, and you get into that. Um, Tell us a bit about your book. What's it called? Obviously we're gonna have a link to it in the show notes of today's podcast, but who should buy your book? Who should read? Who would benefit from reading your book?
So the book is called You Are Not Your Diagnosis, and it's available on Amazon. And the book is partly my own story, so I go more into the details of everything that happened with the misdiagnosis with leukemia and all of the things that I learned in the years that followed that. And then very much also strategies for people to start to implement when they want to take control of their health and start really healing, not just relying on band-aids and pills and whatever the
Nice.
doctor says.
Right?
So, it's really designed to support kind of anybody who's going through some sort of healing process. I mean, really targeted to people with chronic illness, but it definitely, there's wisdom in there if you're, dealing with any sort of health challenge currently. It can help you kind of reframe how you think about the nature of health and healing, and, kind of some of the shortcomings of Western medicine that you might want to watch out for. Not saying, the book is certainly not saying don't ever see a doctor, but it's like, if you see a doctor, bear these certain things in mind, because there are certain kind of downfalls of the whole medical system that you might want to be aware of.
Would you say that your book is inspirational for those who have a recent diagnosis as well? Like, would your book be a really good gift for our listeners to give to their friends in the future who, like, let's say a friend has a cancer diagnosis or a major diagnosis or like chronic disease diagnosis? Would your book be a really good gift to give them that would help them to navigate their emotions and what they're going through and take better actionable steps through that time?
Definitely. Definitely. I mean, that's partly my intention, whether it be, that you've recently been diagnosed, or somebody that you love and care about has recently been diagnosed, or, even for people who've been dealing with something for a while and who are, looking to kind of shift their perspective, and kind of say, hey, this whole just taking these pills and that's as good as it gets. That's not what I want for my life. I think there's more to my life, and I think there's other things I can do. So it's really, my intention with the book is very much to inspire people and to open their thinking to different possibilities, and different steps that they can take as well.
I think that, we are the kind of people that will take better care of others around us before we do ourselves. Not everyone, but like, if that's why I think that your book would be such a great gift, because I could see my listeners and myself included, like every time a friend has a major diagnosis, like giving this book as a gift, like, hey, you're gonna be okay. I'm here to give you lots of hugs and be a shoulder for you and listen to you. And I really want you to read this book because I want you to know that there's a light at the end of the tunnel. Here's the light at the end of the tunnel. Read this book. Um,
Right.
and and I mean, obviously you'll sell more books that way, but but also I think as friends and as people, like as a friend of many people, or a family member of many people, we want to help those we love, and we want to be armed with something when something negative happens, like the grief from being diagnosed with something big, like a chronic illness or cancer. So that's really cool. Now, since coming out with your book, have you heard back from your listeners? Have you heard any stories of success that your book has helped really transform people's lives?
I mean, the book's only been out a few months, and I have definitely had some positive feedback that it's been very inspirational and given some people certain things to kind of think about and kind of reframe, but haven't yet, since it's kind of a new book, gotten the feedback of the longer term transformations people are experiencing as a result of reading it and taking action.
Well, as long as you're hearing back that it's inspirational, you know that your message is getting across, and
Yes.
that was the whole point. So good, excellent. And now you teach body talk as well. So I see on your website that you have a class coming up in Portland, Oregon, Friday, September 14th from 9 to 5 p.m. It's a very affordable class. So is this for lay people to learn how to do it to themselves, or is this for practitioners, or both?
So the class that I teach is our self-care
Nice.
protocol. So we have a simple self-care protocol that you learn it over the course of that one day, but it's designed to be something that takes about 10 minutes out of your day to do. And it includes balancing for kind of your brain and your brain function, your stress, immune balancing, balancing for more of your like physical structure. So some people will say, I don't have to go to the chiropractor as much, which is really cool because they can maintain their own integrity and alignment in their body.
Mm.
And so it's a class that's, I've had people kind of be both, people that are interested in becoming a practitioner of body talk, and it's kind of like a way to explore, get a little bit more insight into the system and learn a few of the kind of core techniques. And most of my students actually are either clients or just people who want to learn another self-care tool to add to their little tool belt.
Nice. And in those 10 minutes a day, which I just love this idea of self-care, 10 minutes a day, because something as simple as writing a gratitude, three things you're grateful for in the morning, have been shown, just something, and that's like it takes less than 5 minutes, just that every morning, have been shown to lift depression.
Mm-hmm.
And so that's just one of many things we could do in the morning that would allow us to tune into our body, tune into our emotional state, and just do this little mental health check. So you got 10 minutes a day. What do you have them do in those 10 minutes? Is it a combination of the tapping and the eye movements and the listening to your body, or is it very structured?
It is very structured. It's kind of five techniques that the founder of Body Talk has kind of felt were the most needed on a daily basis. So we start out with something called cortices, which is the brain balancing technique. That's part of the system, and that's the technique we teach to everybody. You don't have to come to an access class to learn that. There's tons of videos. I have a video, but you can even just like Google Body Talk cortices and find hundreds of videos probably at this point out there of how to do this brain balancing. And then we have something that's called switching, which is our stress level balance. And then we balance hydration, which isn't just like telling people to drink more water, but also addressing the fact that sometimes you drink a lot of water, but your cells actually, there's an imbalance sometimes in our cell membranes and they don't open up and they don't let the water in.
Mm.
So you could literally be kind of like floating in all this extra water that you're like, you're drinking your half your body weight, like some people advise, and you're like, I still don't feel like I'm fully hydrated.
I've been there. I know exactly what you mean. I've drank so much water and I just feel like I'm just floating, but I still feel like something's off. I don't feel like I'm absorbing this, and I know exactly what you mean. So you have a technique to tell the body to be more permeable and allow the water in the cells?
Yeah, it's just a simple technique that basically allows the cell membranes to open up and receive the water that we're drinking.
I
So
have
it's
to learn
pretty
this.
It's pretty cool, like some people, when they do that, it's like they'll run to the bathroom afterwards. Some people, they're like, I've never liked drinking water before, and now I'm like crazy to drink water all the time. So it's kind of a fun technique because sometimes you'll see some interesting shifts in people. Um, and then and then after that technique, we also have something called body chemistry, which is like our immune balancing. So this technique is so amazing because, like, especially when we get into that season where everybody's getting every germ that goes around with, colds and flus, it's like, if you know this technique and you do this routine every day, like, you likely will not get every bug because your immune system is working really well. It's like humming along like a well-tuned machine and says, oh, I see that. We need to get rid of that particular bug before it turns into a cold or whatever it is.
Oh, wow. Very cool. Interesting. Can you teach us anything now? Like, can you have us go through an exercise or teach us a technique now?
Yeah, I mean, I think what probably would be the easiest thing to teach, given that this is audio and the cortices technique, it would just be easier for you to watch a video, is just something that I've kind of developed myself, which is kind of a way to start to do a little check-in with your body when you're experiencing a symptom. So I can just guide everybody through that in just a few minutes.
Yeah, let's do that one. But first I have to know, like, this water absorption one. Is that something you can teach an audio, or do we have to see it?
You'd have to see it, and really it's like the way we do the access technique, the power is in doing all 5 of the techniques together as like a routine. We don't teach people to just kind of say, oh, I think I'm dehydrated, I'm just going to do that one. So but it's a very simple technique involving just a little bit of water. We actually place it into the navel because the navel has all of the meridian points. It's kind of where our brain sometimes registers this is the substance that we need to tune into. And then it's just a bit of tapping and with different hand positions. So
Mm-hmm.
it's very, very simple, but it's just not something that is easy to kind of teach in a format like this. So it's a little spoiler, but you'd have to come to an access class to actually learn it and really understand. Part of the power, again, of the techniques is really understanding the whole kind of theory behind each one, so that when you're doing it, it's not like a rote exercise, but you're like, oh, I know what's actually happening as I'm doing this technique.
Would you ever consider teaching it virtually so that people around the world could learn it from you?
So unfortunately, the BodyTalk system has that class be something that's taught in person. So there are actually, I'm called a BodyTalk Access trainer, and there are trainers actually all around the world that teach this class. So I'm not the only person that teaches it, but it has to be at this point taught in person. It's not something I can teach online. But I did ask because I was like, I want to do that.
Yeah, I don't blame you. Very cool. So someone could find a local practitioner to learn Body
Yes,
Talk Access, which is the name
right.
of the 1-day class,
The self-care
the
class.
self-care
Yes,
class. Well, that sounds like a lot of fun. And then
it really
we
is.
should tell whoever that you sign up with, tell them that they heard this episode.
Yes,
Yeah.
so that they know who's spreading the
Who's
word about
spreading the
body
word?
talk.
Yeah. Very cool. Okay, I'm ready to learn your technique for listening to the symptoms of the body.
Okay. So first, just everybody just start by taking a couple nice, deep, easy breaths. You've been listening and you've been kind of in the thinking part of your brain. So now just be present with your body and just take a couple nice, deep inhales and a couple nice, deep exhales. And then you're just going to start. I like to start this with what I call a body scan. So you're going to start up at the top of your head and you're going to work your way down, just noticing any areas. You may come into this already knowing an area that you want to tune into, but if you are just listening to this and you don't have an area that's already kind of screaming at you, just notice any tension anywhere in your head, in your face, in your neck, in your shoulders. anywhere in like the front of the torso, kind of with your lungs, your heart, maybe in your digestive system, your stomach. You can tune into the back of your body, your upper back, your mid back, your lower back. And then don't forget to just give the arms a little bit of attention. So just kind of scanning through your right arm, both the upper arm, and then down into the lower arm and the hands. Same thing with the left arm, just working your way down from the shoulder. And then just kind of noticing into like the pelvis and the hips. And then both of the legs, just kind of the upper portion of your legs, front side, your quads, back side, kind of where your hamstrings are, your knees, your shins, your calves, and then your ankles and your feet. So if you're guiding yourself through this, you do this again. You can take as much time as you want to scan through. But what you're going to do for the purpose of this is you're just going to pick one area that feels like maybe it's talking to you the loudest in terms of there's a pain or a symptom, or you're just really drawn to that area, you're curious about it. And then bring your focus to that area and just ask it what its message is for you right now. And if you don't immediately get an answer, you can just be patient and maybe just repeat the question a couple times and just see. Don't get frustrated or feel like you're failing if it doesn't immediately come to you. Because this is, for many people, kind of a new practice. And then after you get that message of what it needs you to know, you can ask also, is there anything that that area needs from you? And this could include things like just getting out in nature, going for a walk, drinking more water, just anything that that area wants you to know that maybe it's asking for. And again, with that question, if you don't get an immediate answer, just be patient and kind of just gently repeat that question to yourself. So once you've kind of received those messages, the other thing I always like to remind you is it's important to not just say, oh, well, that was nice, and you said you needed me to do this, or it's requesting that, and then you don't do it. But if you want to build that new relationship with your body and you want to communicate with it and listen to it, you actually have to try and follow through with what it's requesting. So just really being aware that if it asks for something and it's within your ability to do that thing, then to try and find time within today or at least by tomorrow to do that thing. And that's basically it. So it doesn't have to be very complicated. You can even add your own questions if you have a sense of like something else you want to know from that area. That's not something that you have to just limit to those two questions, but I think those are kind of two questions to start with for sure.
And that was 5 minutes.
Yeah.
Yeah, so we have like 5 more minutes if we were doing a 10-minute a morning routine.
Yeah, so I like to say that this thing, you can do it, really quickly. And when you get really good at it, you might not even need 5 minutes. You could just really get quiet very quickly. And it's like, oh, what does that area need? What's its message? And you're done. Or you could make it a whole meditation. You could spend 15, 20 minutes just kind of tuning into that area or, doing a second area if you felt like there was a second area that really wanted to have communication with you as well.
So and oftentimes when the unconscious mind starts communicating with people, they doubt the first, because it's such a clear and quick answer. And sometimes they're like, was
Mm-hmm.
that it? Was that real? Was that it? Like, 'cause they're expecting something different than the familiar voice they're used to. They're like, wait a second, I thought, I've never talked to my unconscious mind, so I thought it was going to be different. And we realize quickly that when we start to ask our body questions and then we get answers right away, it's like, well, that was just me answering that. That wasn't
Yeah.
that was just like, so if for example, like my shoulder blade, the rhomboids, the muscles in between the shoulder blades are kind of burning. Um, and I'm thinking the answer is like, I need to go move and walk and stretch and get up off this chair, because we've been sitting for 90 minutes. And that's the message, right? But it's just it's my own voice basically answering it in my head. And so is
Hmm.
that what we're listening for? We're listening for the very clear, the first answer that comes to mind that says, I need to do this.
Usually that's pretty accurate, as that's how it works. I mean, and then yeah, you're right. Especially when you're newer at doing that, you kind of second guess. That can't be the right thing.
Right.
I thought I was going to get this answer, or that's just silly. But it's like, the more you do it, the more you realize that that's, especially if you can just kind of center yourself first and you're not in all that head chatter that you might have been in, 10 minutes before. And you're just like, no, I'm just being present with my body. Usually that first answer is very much the answer that is from your body
And then
or
all the
from your
other
subconscious.
doubting, whatever the doubting Thomas answers, those aren't the right ones. Listen to the first one. That was the real one.
Exactly.
I always have these amazing intuitive experiences where my intuition, my body tells me something, right? And then what comes immediately next is, oh, that's silly. Like, why would I? It's sort of like, bring an umbrella, and it's like blue skies, no rain for the next week on the. And my intuition says, bring the umbrella. And then the second voice goes, that's silly, I'm not bringing an umbrella, right? And of course, what happens an hour later, I need the umbrella. But
Right.
sort of like those experiences, it's that quick voice that comes in, and then everything else, starts to doubt it. And we've got to turn up the volume on the first voice and turn
Hmm.
down the volume on all the doubting voices. What are these doubting voices, like that sort of doubt our intuition? What are they?
I think one of the things that makes a lot of sense to me is that, we've gotten used to using like our head brain a lot, like the brain that we all think of to do things it's not meant to do. So our intuition is much more kind of body based. It comes more from like our gut, and it's like there's a reason we say my gut reaction, my gut instinct, because that's actually your intuition. But the head brain wants to jump in and be like, no, that's silly. That sounds stupid. That you sound really crazy. If you talk to people like that, they're going to think you're a nut.
So it's like our logic brain, or the higher self, right? The higher part, the not higher self, but the higher brain, right? The
High
high
thinking. Yeah.
thinking, the one that likes academia, right? Is going, this is all woo woo and silly, and give me the science and show it to me on a lab. And this is crazy, quantum schmontum, that's crazy. And so we've been using the wrong part of our brain to do the healing, because that part of our brain is like really great for if we needed it to like help build a house. So I would hate to use my gut and intuition to build a
Yeah.
house. Really would not work out very well. Um
Very true.
right?
Might like fall over or be all
Right,
crooked.
right. Well, just exactly. Right. It might like feel like the feng shui might be there, man, but it would not hold up against the wind, right? Because the higher part of our brain is where like the engineer is. I remember once a woman used her intuition to decide or make her business decisions for her. I kid you not. She opened a hypnosis center on the Big Island of Hawaii, and it miserably failed, because it's
Mm.
like, great, well, if you could have opened up your hypnosis center in, the more populated areas of Hawaii, but she chose the area that's like, there's 200 people in this village, and she opens up a hypnosis center because her unconscious mind, wants to be near the ocean on the Big Island, not near a lot of people. And it's like, but the business decisions should not be, don't use your like feelings and gut, to make those kind of like very logic based decisions. So we want to use the logic mind when it comes to that, but then, when it comes to stuff around healing, that's when we go, okay, gut, okay, body, we need you to start talking to us. And we need to start
Exactly.
listening, and then like every time we need to identify those little voices, go, hey, wait a second, that's that logic brain that's trying to butt in. This is not your job, logic brain. You go over there
Yep.
and help me with logic
Go
brain
build me a
stuff. Go
house.
build me a house and run my business. I'm going to heal the body with my gut brain and my intuition right now and my heart brain. So cool. Very cool. So distinguishing the difference between those voices would really help while doing this 5-minute exercise. But
Definitely. Yeah,
yeah,
because it's a practice, in the beginning, you're probably going to run into either you don't hear anything because you're like stressing out, like, oh, I'm not good at these kinds of things, and I don't know, I'm not gonna get the right answer, and then if you do it more and more, then you start to really go, oh yeah, like that makes, I'm trusting it. I know that what I'm getting is the actual message instead of, I don't know, are you sure that was the right thing? Because I think it's this other thing.
right. But all that self-talk you just identified, like, I'm not good at these kind of things. And was that really it? I don't think that's it. All that chatter is the logic brain and where our limiting decisions live. But our limiting decisions don't live in our gut brain and in our intuition. They're the
Mm-hmm.
pure unconscious that wants to help us heal.
Right.
So
Very much.
having to identify the difference between the two is really important. Especially when beginning to listen to the bodies. Cool, because I found that when I first started sort of getting in touch with that little voice, that little intuitive voice, it was like a whisper. And then the big booming logic brain could immediately overtake it and say, no, no, you're wrong, that's stupid, move on, move on. And now
Shut
I've
up
yeah,
over
yeah,
there.
well, exactly. Exactly. And now I've okay, I imagine, like, it's really, I love that part of hypnosis where you can like imagine the big knobs, like you have a giant hi-fi stereo from the 80s, and turn down the volume on the logic brain, turn up the volume on your intuition, and begin to hear that clearly, much, much clearer. Excellent. So thank you so much for teaching us this technique. That's very cool. Do you recommend we do it daily, or do you recommend that if we start to get a headache, should we just stop and just start listening to the body and start asking those questions? How should we use this?
I think, there's different ways to use it. I think it would be great, like every day, to kind of use it as a check in, whether that be kind of to start your day or, maybe like a midday check in. But again, you can use it too. Like if you're starting to feel something, I mean, I like to say it's nice to do that rather than, oh, I've got a headache, I'm going to go grab a Tylenol. Like, well, I've got a headache. Maybe I should check in with my body and ask first, what's going on? Why do I have this headache? And not just reach for the thing to quiet it and make it go away.
Absolutely. Now I have this burning question. Tell I need to learn more about the eye movements thing. I feel like you keep mentioning it, and it just seems um like something we need to know a little bit more about. So, and I've heard this before. I had other guests on the show that would offhand say something like there was studies done and they discovered that when those with brain injuries or chronic brain illnesses like Parkinson's practiced eye movements looking up and down. So sort of like if you're scrolling through social media, you look up, you look down, you look up, you look down. They discovered that their Parkinson's shakes would diminish. And so there's something
Hmm.
about eye movements and neurology and this amazing thing we have this brain science, which we're just scratching the surface when it comes to understanding this thing we have between our ears. So, can you tell us just a little bit about the eye movements and why or where did this come from? How did this become part of your modality?
I don't really know the exact answer to how it became part of the modality, but kind of my understanding is it's like when we do circular eye movements in one direction, it kind of is like helps to bring up that memory. So it's like kind of digging in and resurfacing what we experienced at that time. And then when we switch and we go the other direction with the eye movements, it starts to actually like dissociate that memory and the emotions from the brain. So I think in some ways it's similar to like what EMDR does with eye movements as well, to kind of like integrate the trauma into the brain. And then once we do the circles, we actually switch into, we do like a side to side motion and then an up and down motion. So it's kind of like all of the different ways that the eye can move. And it accesses, I know, different brain centers, the way memories are stored and things like that. I don't know the exact science of it, but I know that that's kind of the basis of what's happening there, as we're just moving the different or working through the different brain centers and helping. Basically the emotion never got kind of processed and integrated, because when we have a memory, we should just be able to remember the memory and not get kind of re-traumatized or stuck in the emotion that we felt. So like if we were in a car accident and we had a lot of fear that we were going to die, we shouldn't have to still think about that memory and feel that same thing of being in that car at that moment. So we're kind of helping to release the emotion that never got fully kind of integrated at that time. And that's a lot of what PTSD is too, is it's just the trauma hasn't fully processed and integrated through the brain.
Have you worked with someone with post-traumatic stress?
I've worked with people with more of the sense of like childhood traumas, like very
Mm-hmm.
difficult upbringings with, parents who were neglectful, and abusive in certain ways. And I would say that in some level qualifies as PTSD for sure, but not necessarily in the sense of like somebody maybe who's gone to war or kind of that type of PTSD.
I've heard of the using eye movements in therapy with post-traumatic stress, and how it makes it more effective. So this is interesting to hear from you that it's effective. What about addiction? Have you worked with people with addiction?
I have one client that is addicted to marijuana and she wants to be able to stop smoking. And so that's one of the things that I've been helping her with. That's not something I've worked with a lot of people on, but that's definitely, I know a lot of people do use body talk for that, just like, hypnotherapy is pretty effective as well.
How about depression?
I definitely see people with both depression and anxiety for sure. And depression usually kind of comes along with either the chronic pain or the chronic illness, because our lives have changed, and then the pain brings depression, or not being able to do what we want to do. That it's just kind of built right into the experience of living with those types of conditions at that time.
So what kind of person should come to see you? Anyone? Should anyone come to see you? Or are there like should they have a chronic illness, or because I have a feeling like you're going to say everyone could come to see you, because you are giving people tools that just make their lives even better no matter what.
Yeah, I mean, body talk certainly can be used for just about anything. People say, "Can I do this?" It's like, why not? Why can't we address it that way? But in my practice, I tend to see more people with either chronic illness, chronic pain, and I'm also starting to see a lot more like professional women who've been just really busy with their work and neglecting their health. And so they kind of are starting to have, adrenal fatigue, and they've picked up weight because they're not exercising. And I'm starting to see that, like these people that are starting to realize, oh, I can't continue to burn the candle at both ends for forever and have my body just hold up to this.
Right. Right. Exactly. Exactly. We want to catch it early instead of wait till our body breaks under the pressure of stress and life. Right.
Exactly. So it's like I kind of like to work with the people who are currently living with chronic illness, but I also like to kind of take a preventative approach for many, where it's like they're kind of seeing that, like, oh, that's coming down in my future. I don't really want that. It's like
Mm-hmm.
let's prevent it. Let's divert what's happening and get you really to a healthy place, instead of you getting a scary diagnosis and then you come see me.
Absolutely. Now, out of all the books you've ever read, what book has been the most transformational for you that you'd recommend people read? But of course, besides your own book.
um, I would say probably one of my favorites is Bruce Lipton's Biology of Belief.
And why is that?
I think, some of the stuff we were talking about of just that science of like what happens when we believe certain beliefs, I mean, it ultimately comes down to mindset is so important in our healing. And I think he has a really unique take on things because he was a Western medical doctor and then he kind of shifted into this field that people would probably say is more woo woo, but he really understands kind of the science of it and then kind of the more metaphysical aspects. But I also have to put a plug in. I'm reading right now The Upside of Stress, which I don't know if you've heard of
Mm.
it, but it's fascinating. It's all about how stress actually doesn't have to be a bad thing for us. It's, again, our beliefs about it.
Hmm. I believe my naturopath was reading that book and flashed it at me. I believe that what you're saying is recalling a memory of about maybe 2 months ago, her telling me that's a good book. So it's cool. I'm definitely gonna have to check it out. The
Yeah,
Upside
I
of
think
Stress.
Kelly McGonigal is the author, and I'm partway through it and just like really, really intrigued by it. So
Nice. Very cool. Awesome. Well, so your website is bodytalkportland.com. For those who aren't near Portland, is there anything on your website that they should check out, obviously, besides your book?
Yeah, I actually work with people both locally and at a distance. So, if you feel drawn to having a conversation about how I might be able to support you, don't feel like you have to be in Portland in order for it to work because I work by phone quite a bit. And it's actually, I love distance work. It's kind of my favorite. So, so you can check out any of the offerings and not feel like, oh, I'm not local. The only thing is the access class, but if you get enough people together on a location and you want a class, then we can talk about having a class in that location.
Nice. I love it. Well, so listeners can check out your website, can contact you if they'd like to work with you around the world through Skype so you guys can both see each other.
Mm-hmm.
Excellent. Is there anything that you'd like to share or say to wrap up today's interview?
I think just, if you're somebody that's either knows somebody living with a chronic illness or you're dealing with that yourself, just knowing that there are other solutions. I had a very wise healer friend of mine say, when a doctor says something is chronic, it just means they don't have a pill or a surgery to fix it. That's all it means. I'm like, bingo, but is that the only two options in the world? Certainly not.
Right, and now their big thing is, oh, it's genetic. And that do not let that be the end all be all. If a doctor says it's genetic, they want to save face and they don't know how to tell you that they don't know what the heck it is or how to fix it and they don't have a pill or a surgery for it, so they're going to blame your genes.
Right. And actually, most of our illness is more epigenetic, which I saw you interviewed somebody about that. So it's more about how our genes express rather than the actual DNA itself.
Right, which means and epigenetics means that it's not baked into the cake and we can
Change it.
yeah, change it or support it, in many different ways. So yeah, I've had several interviews on how we can work with our the epigenome to support our body in expressing the genes the healthiest way possible and turning on gene processes. It was fascinating. We can turn on and off the ability to suppress tumors.
Mm-hmm. And that's actually built into BodyTalk. One of my mentors actually worked in the Human Genome Project, and she's developed all sorts of. She's a PhD researcher, but now a body talker, and she developed a course specifically on how to work with that sort of tool set in BodyTalk. So it's really cool.
Ooh, awesome. So do you go and like learn as I have a feeling Body Talk is like an ever expanding tool set like NLP is where it's constantly developing. So are you like can other body talkers learn those techniques and then incorporate them as well? Is that how it works?
Yep. Yeah. There's kind of core courses, and then there's all these electives either the founder has created or some of our senior instructors create their own courses. And yeah, you could be taking, 20 classes a year if you wanted to, and you had the means and the time to do it. So yeah, I'm usually at least taking a couple new things each year just to grow and expand my tool set.
And where do you go to take them? Like, do you have to fly to Australia, or are they here in the States?
They're here in the States. Actually, the founder now lives in Florida, and there's instructors globally. Most instructors kind of travel to different locations. So I've traveled kind of more West Coast. Like I've gone to California for a few classes. I've actually gone up to Canada a few times for classes, Seattle. So it just sometimes depends on, what's close by, and sometimes you have a place where a friend you can stay while you're traveling. So that's always convenient too, to look for a
Right?
class when,
Right. Well,
when
I
I
live in
can get to.
Seattle, so you're welcome to come stay at my place if there's a class. Come
Oh,
on down.
thanks.
I got a guest bedroom. It looks over a beautiful field with deer and bunnies in my vegetable garden. And so and if you're
Wonderful.
here in the right season, I'll give you a 12-pound zucchini. So
I know how those go. We grew those growing up.
Right? Awesome. Yeah, it's my first time. We finally put in a garden, and I love it because my son, we just, I mean, he helped plant the seeds, right? He's 3 years old. And then just recently in the last few weeks, we're watering the garden and the zucchinis are coming in. And I'm like, I think we want to wait for them to be a bit bigger. And he's like, no, he's like ready. So he doesn't, I didn't even tell him how to pick it. He just reaches in, grabs the zucchini, twists it, pulls it off out of the ground, like pulls it off the plant, tears the wilted flower off of it and takes a big bite. And I'm like, there you go. Like that's instinct right there. He was listening to his gut voice, right? The gut mind was telling him, take a big bite of that fresh zucchini right out of the ground. Yeah, it was
Nice.
really cool. So talk about, being in tune with your body and listening to what it needs. Excellent. Well, thank you so much. This has been wonderful having you here today and learning about what you do and body talk, and especially your book, which of course the link to everything you do is going to be in the show notes of today's podcast at learntruehealth.com. I urge listeners to buy your book and give it to those friends of theirs who have recent or chronic diagnosis, because we want our loved ones to know that they are not their diagnosis and that there is light at the end of the tunnel. So thank you for coming and sharing your message with us today.
Well, thank you for having me. I really enjoyed it.
Hello, true health seeker. Have you ever thought about becoming a health coach? Do you love learning about nutrition and how we can shift our lifestyle and our diet so that we can gain optimal health and happiness and longevity? Do you love helping your friends and family to solve their health problems and to figure out what they can do to eat healthier? Are you interested in becoming someone who can grow their own business, support people in their success? Do you love helping people? You might be the perfect candidate to become a health coach. I highly recommend checking out the Institute for Integrative Nutrition. I just spent the last year in their health coaching certification program, and it really blew me away. It was so amazing. I learned over 100 dietary theories. I learned all about nutrition, but from a standpoint of how we can help people to shift their life and shift their lifestyle to gain true holistic health. I definitely recommend you check them out. You can Google Institute for Integrative Nutrition, or IIN, and give them a call, or you can go to learntruehealth.com/coach, and you can receive a free module of their training to check it out and see if it's something that you'd be interested in. Be sure to mention my name, Ashley James, and the Learn True Health podcast, because I made a deal with them that they will give you the best price possible. I highly recommend checking it out. It really changed my life to be in their program, and I'm such a big advocate that I wanted to spread this information. We need more health coaches. In fact, health coaching is the largest growing career right now in the health field. So many health coaches are getting in and helping people, because you can work in chiropractic offices, doctors' offices, you can work in hospitals, you can work online through Skype and help people around the world. You can become an author, you can go into the school system and help your local schools shift their programs to help children be healthier. You can go into senior centers and help them to shift their diet and lifestyle to best support them in their success and their health goals. There's so many different available options for you when you become a certified health coach. So check out IIN, check out the Institute for Integrative Nutrition. Mention my name, get the best deal. Give them a call and they'll give you lots of free information and help you to see if this is the right move for you. Classes are starting soon. The next round of classes are starting at the end of the month. So you're going to want to call them now and check it out. And if you know anyone in your life who would be an amazing coach, please tell them about it. Being a health coach is so rewarding and you get to help so many people. Have a fantastic day and enjoy this amazing interview.